Good morning, everybody. I'd like to welcome everybody to the April 20th, 2020 briefing on essential patients, and wanted to just introduce myself. My name is Dr. Aki Al-Zubaidi. I'm the co-CEO of EON and interventional pulmonologist at National Jewish Health. I am not the guy from Key and Peele, but definitely like his work for sure, Ron. So today what we're going to discuss is go over the essential patients that have been deferred, in addition to going over what safety net is, how you can get your hospital signed up and activated within 7 days. Let's start by looking at today's numbers in terms of essential patients and diverted office visits. So if we check that out, you can see that today, just going on to the eonhealth.com website, that today there was 1.8 million diverted visits. Again, the total diverted visits to date are approximately 37 million. Deferred essential patients within those office visits is 7.4 million, and the total procedures missed is now up to 243,000. If we can take a look at today's date on the essential patient curve, you can see that we're still at a very high diversion rate. However, what we're getting is that, and let me remove that I'm not the guy from Key and Peele. Sorry about that. We can see that, this is showing still hospital efficiency ratings down to 90%. And really what's important to know is that what we're hearing and what we're seeing is that there's preparation for hospitals to get back to business. And what that means is service lines that have been discontinued or stopped or severely reduced to ramp up those particular service lines safely over the next 3 to 6 weeks. And so we think there's no way better to do that than identifying the patients that are below that green line on the website, which are representing the essential patients, getting that bolus in first, making sure that they're seen, and then going through and queuing up the rest of the patients that way. And let me just show you guys real quickly how an essential patient report works and how safety net works. And I'll bring that up here on the screen as well. So here you can see that there is this is an example of just an Excel sheet. That's the essential patient report. And let me make it a little bit bigger because this is difficult for me to see as well. But here we go. You can see here that the way that we are laying out an essential patient report is that you'll get a hyperlink that clicks to that particular patient, and then the highest risk patients that need follow-up are obviously first. So for this particular, in this particular instance, you can see that we're showing the 4Xs, the 4Bs, and this is a lung cancer screening population where you need to try to get the 3s in to get scanned if they're due or overdue, and then the 4As, 4Bs, and then also the 1s and 2s to be queued up to happen once ramp up occurs. We also have, if the patient doesn't have any follow-up that's listed for them in terms of the screening population. And then in terms of incidental lung nodules, as you can see, is that we display those in terms of the nodule size from greatest to smallest. So in terms of an essential patient report, that's what you're going to see with an essential patient report from Safety Net. But in addition to that, what you'll also see is that you'll have access to the mobile application, which will be up on the App Store, I think later today or tomorrow. And if you do have a Google Play or Android device, that is already on the website, the Google Play Store, where you can download. You do need an account to be able to utilize Safety Net. However, if you do have an account, what you'll see is that you'll see the essential patients, no follow-up, non-adherent, and very much like that particular report that you saw that's in Excel, you can actually, you'll have actionable items that you can actually do. So like if I had a low-dose CT scan and I can look at the actual CT report, I can say, okay, hey, this patient needs to get in and get a PET scan. I can send that note to the coordinator or to the scheduler and make sure that that happens. If it doesn't happen, the patient doesn't come in or they get moved to the right, that also can be captured in the system as well. So just real briefly, what I wanted to go over real quick is that there is still a big bolus of patients that continues to add as service lines are either discontinued or halted, or greatly reduced. Listen, patients also, aren't wanting to come to the hospital or to an office visit as they probably previously would, because they're uncomfortable and they want to make sure that it's safe. So what we're saying is that you have to have a standard operating procedure in place that is safe to see patients, in which the providers, the staff, and the patients are not exposed or have risk of being infected with COVID. And then in addition to that, you need to have a standard operating process which has high throughput, high efficiency. And then you need to triage your patients from highest risk in terms of them suffering mortality and morbidity over the next 30 to 90 days. Get those in first, make sure that they're seen, and then work through your other backlog of patients from top to bottom. In terms of safety net, 3 easy steps: fill out a packet, get it in by Friday, have an activation by the next Friday, start getting the essential patient reports, have access to the mobile app. It's all free. Very, very simple. SOC 2 controls will be coming out with some more items in terms of how you can get signed up for Safety Net. As long as you get it in by this Friday, we can get you activated by next Friday. So please reach out to us at eonhealth.com. Looking forward to talking to you guys tomorrow. We do have some more data that's rolling out. There's also some guidelines in terms of who to scan, who not to scan from some of the leaders in nodule management. We'll be looking for that to be released either prior or right at press. And we'll be talking about that Wednesday or Thursday as well. I'd like to thank everybody for joining. Tomorrow we'll be talking more about Safety Net, how you can get your hospital signed up just in 3 easy steps, have it activated within 7 days. Thank you, everybody. Talk to you guys tomorrow.